Hello and welcome to Medicare. This seminar is brought to you by the Artist Health Insurance Resource Center at the Actors Fund. If you're not familiar with the Actors Fund, this is who we are. We provide services to performing arts and entertainment professionals over their lifespan. Among our services are social services, housing services, a career center, health services. We encourage you to visit our website, actorsfund.org, and explore the many services and seminars that are offered. This seminar is intended to make you familiar with Medicare, beginning with some of its terminology. By the time we're done, you'll know what original Medicare means, what a Medicare supplement plan is, what a Medicare prescription plan is, what a Medicare Advantage plan is. You'll know what an initial enrollment period is and what a special enrollment period is. Medicare is health insurance for people 65 and over or people under 65 with certain disabilities, and people of any age with end-stage renal disease. If you're wondering when Medicare begins, for people who are eligible because of a disability, it begins 24 months after collecting Social Security disability benefits. In the case of people turning 65, it begins the first day of your 65th birthday month, unless your birthday is the first day of the month, in which case it will begin the first day of the month prior to your birthday. In order to get started, if you're collecting Social Security, retirement, or disability benefits, you will automatically be enrolled. If you're not collecting, you would have a 7-month initial enrollment period. And that period is 3 months before your birthday month, the month of your birthday, and 3 months after your birthday. When your Medicare begins depends on when you enroll. If you enroll in the 3 months before you turn 65, your coverage will begin the first day of the month you turn 65. If you wait until your birthday month, it will begin the first day of the following month. And if you enroll in the 3 months after your birthday month, it will get progressively delayed by 2 to 3 months. Therefore, keep these dates in mind when you enroll so that your Medicare will begin when you want it and need it to begin. The way to enroll in Medicare is either online by going to the Social Security website and choosing to apply for Medicare benefits only. One caveat is that if you were at any way impacted by the 2017 Equifax data breach, you might not be able to enroll online, as Social Security might have blocked electronic access to your Social Security account to protect you from data breaches that you were subjected to, whether you know it or not. In that case, you would enroll by phone by calling your local Social Security office or the main Social Security number, 800-772-1213. In person at a Social Security office is not an option during the pandemic, as Social Security offices are closed to the public. Let's explore the different parts of Medicare. You have Part A, hospital inpatient insurance. Part B, medical insurance. Parts A and B are called Original Medicare because they're the only components of Medicare that are managed directly by the federal government. In addition, you have Part D, Medicare prescription drug coverage. You have Medicare supplement plans, also known as Medigaps. And you have Medicare Advantage plans, which are sometimes referred to as Part C, or Medicare health plans. Let's look at each one, starting with Part A. Part A covers inpatient care in hospitals, and this means that you would have been admitted to the hospital as a patient. Medicare does not consider an overnight stay for observation in a hospital as a hospitalization. They deem that a hospitalization entails spending 2 nights in the hospital. Also, Part A covers that inpatient care only in the form of room and board and nursing care. Any care you receive from doctors while hospitalized would fall under Part B that we will be looking at next. It covers skilled nursing facility care that you might need after your discharge from the hospital. And it covers home health care that you might need after being discharged from a hospitalization. And finally, it covers hospice care, which is care that you would need if you're diagnosed with a terminal illness and would need hospice care for the remaining months that you have left to live. In terms of cost, Medicare Part A has no premium for those who have worked 10 years in the United States. That's because during that time, you've been paying Medicare taxes, and therefore Medicare is paying you back by exempting you from a premium. It does, however, have a considerable deductible for hospitalizations, $1,484. And that deductible is per benefit period, not annual. And the benefit period runs up to 60 days. This means that if you're hospitalized more than once in a year, you might have to pay that deductible more than once in a year. For skilled nursing facility stay, there is a zero copay for the first 20 days. If you stay beyond that, you will have a $185.50 copay per day for days 21 through 100. For hospice, you pay nothing for hospice care received at home, except for a copay of up to $5 for prescriptions you might need for pain management. If you receive your hospice in an inpatient respite care facility, you would have a 5% copay of the Medicare approved amount. Let's move on to Part B. Part B covers services from doctors and other healthcare professionals, mental health care, some preventive services, home health care, durable medical equipment like wheelchairs, walkers, oxygen, many diagnostic tests and lab services, diabetes supplies and self-management training, physical and occupational therapy, and more. To see everything that is covered, you would go to the Medicare website, medicare.gov, and look up what you want to see coverage for. Medicare has moved with the times and devised an app that you can download onto your smartphone, and it can help you determine what is covered and could come in handy if you're sitting in the doctor's office and they tell you you need a certain service. You could look it up right then and there and see if your doctor needs to do anything in order for that service to be covered or to happen. What Part B does not cover is long-term care, routine dental care, including dentures, vision care, hearing aids and exams for fitting them, acupuncture. There is a limited exception for people suffering from chronic back pain, but that is the one and only exception for acupuncture. And it does not cover cosmetic surgery. The costs for Part B, there is a premium. For individuals who made less than $88,000 a year, or in the case of couples filing jointly, the premium is $148.50 a month. Part B has a deductible, $203, but it is annual, unlike the hospitalization. For most Part B services, Medicare pays 80% and you would pay 20%. There are exceptions: lab services, blood tests, some screening tests, certain preventive services, many of which are covered 100% by Medicare. If you go to the Medicare website, there is a list of services that are covered at no cost to you. But just to give you an example, your annual physical is covered 100%. As is the blood work that physical usually requests that you take. Colonoscopies, mammograms, prostate cancer screening, your annual flu shot, your pneumonia vaccine, all of those are covered 100%, and you would not have to pay the deductible. If you're wondering when to enroll in Part B, essentially the enrollment period is the same as for Part A, unless you're covered under a group health plan based on current employment, yours or that of a spouse who is covering you as a dependent. And by group health plan, Medicare defines that as a plan covering more than 20 people. If you are covered by a group health plan, you could delay enrolling in Part B, as you would then have a special enrollment period to sign up for Part B when you lose your employment and the group health plan that goes with that employment, whichever happens first. But please note that you can't use a special enrollment period if your employment or the employer provided group health plan ends during your initial 7-month enrollment period, the 3 months before your birthday month, and the 3 months after your birthday month. There is a late enrollment penalty if you do not sign up in time. And please be aware of the fact that Medicare does not consider COBRA as being active coverage. Therefore, if you are losing your employer plan, do not elect COBRA. Please enroll in Part B to avoid any problems. This is a diagram that might help you determine if, as a working senior, you do need Part B. If you're covering a younger spouse and child, and there is any way for you to stay on your active work plan, not COBRA, you could defer Part B in order to keep covering your family. If you're covering just yourself, what you want to ask yourself is whether your work plan premium is less than the Part B premium. And depending on whether the answer is yes, in which case you probably would want to try to stay on that work plan as long as you can. If it's no, then sign up for Part B and look into your Medicare options. And those Medicare options are what we're going to look at next. You have choices on how you get your Medicare. Once you enroll in Medicare, you will get Parts A and B. Typically, once you enroll with Social Security, they take about 4 weeks to process your application. After that, you will have a Medicare number. Once you have a Medicare number, you can start selecting your Medicare options. Starting with Part D, you have Medicare supplement plans called Medigaps, and you have Advantage plans. Let's look at them one at a time. We're going to begin with Part D. Part D is prescription insurance. Unlike Parts A and B, Part D is sold through private insurance companies, so you have a choice of many plans. The best plan for you depends entirely on your prescription needs. You will have to pay monthly premiums, deductibles, and copays. So you will want to consider all those factors when choosing a plan. The average premium for a prescription plan is $33. The least expensive premium is $7.30. These plans are regulated by Medicare. Therefore, they cannot charge more than $445 deductible. And please note that the deductible only comes into play if you have name brand medications. If you take a generic, you would never have to pay the deductible. The plan would start covering your medication right away. Your copays vary depending on the cost of the drug, and they might be cheaper at certain pharmacies. A lot of these plans have certain pharmacies that are in network with them, and therefore you would have to take that into account. And you could do so by using the Medicare Health and Drug Finder at medicare.gov. It's the best resource for finding your best plan. Let's move on to the supplement plans, also known as Medigaps. The reason they're nicknamed Medigaps is that they cover the gaps in Medicare, like copays, coinsurance, and deductibles. There are 8 federally standardized plans to choose from. They're all sold by private insurers, and each plan is standardized. Therefore, they have to offer exactly the same benefits no matter which insurance company sells it. So cost should be the only consideration for you when choosing a Medigap policy with the same designation. You have the right to buy a Medigap plan during what is known as the 6-month open enrollment period. That period starts the month you turn 65 and enroll in Part B. After that, your right to buy a plan varies by state. In New York and New Jersey, you can buy a plan at any time. But if you have missed that 6-month period where you have what is known as a guaranteed right issue, where they cannot subject you to any medical underwriting considerations, you might see yourself imposed with a waiting period to cover pre-existing conditions. Last note on Medigaps is that if you're a New Yorker, you can change plans at any time with no waiting period. So if you don't like the plan you originally signed up for, you could then pick a different plan and switch to it the next month. Here is a chart that explains how you compare the supplement plans. A check mark means that 100% of the benefit is paid. Therefore, obviously, if you want the most comprehensive plan, you would look for the one with the most check marks, which on this chart, as you can see, is Plan G. As you can imagine, however, it also has the highest premium. You can get a lower premium with some of the other plans, including Plan N. If you see that little note under Part B, it means that you might have to pay a $20 copay for certain office visits on that plan. But as you can imagine, the premium is less than that for Plan G. Plan G has a high deductible option, which has a much lower premium. But you would first, of course, have to pay the deductible, which is $2,370, before the plan starts paying all the things that Plan G covers. For more information, I suggest that you sign up for an individual consultation to get a better sense of these supplement plans. Let's move on to Medicare Advantage plans. Advantage plans are also sold by private insurance companies, and these plans replace Medicare Parts A, B, and D. If you join an Advantage plan, you still have Medicare, but you'll get your coverage from the Advantage plan, not original Medicare. And they have different rules on how to get your services, such as whether you can go to an out-of-network provider. As of this year, there are plans that do let you go out of network. Advantage plans have to cover all services that original Medicare covers, and many offer extra coverage like vision, hearing, dental, and wellness programs like free gym memberships. When you belong to an Advantage plan, you still pay your Part B premium, but many Advantage plans have a zero premium. Advantage plans have a different way of charging for out-of-pocket costs, like copays, premiums, and deductibles, than original Medicare. So it's not that 80-20 equation. And once again, the Medicare Plan Finder is an excellent resource for finding the most suitable Advantage plan for you. Just to give you an idea of Advantage plan costs, your average primary care doctor visit would be a $10 copay. Specialist would be a $40 copay. An ER visit would be a $90 copay. And inpatient hospital care, on average, you would have a $350 copay per day for days 1 through 5. For days 6 onward, the plan picks up all the costs. If you're wondering when to enroll in Part D or an Advantage plan, essentially, once you have a Medicare number, having enrolled in Part A and B, you would then want to get all the other moving parts of Medicare. If for some reason you do not enroll during that time, you'd have to wait until Medicare fall open enrollment period, which is every year from October 15 to December 7, with benefits beginning on January 1st. One final note is to call your attention that for Part D, there is a late enrollment penalty. 1% of the average Part D premium, which is currently 33 cents, for every month you delay enrollment. This will be added to your monthly premium and it will never go away. If you think 33 cents is negligible, pull out your calculator and figure out what would happen if you took no medications and decided not to follow our advice and enroll in a prescription plan. And then 11 years down the line, you find that you do need to start taking medications. You would have a $45 late enrollment penalty slapped on top of whatever premium you pay for your prescription plan. So please remember that the cheapest prescription plan is $7.30, and therefore, even if you take no medications, do yourself a favor and enroll in a prescription plan, because you never know what could happen, and it would be very unfortunate to see yourself slapped with a heavy late enrollment penalty for saving $7.30 a month. Before you enroll, check with your doctors to see if they take Medicare, specifically what's known as Medicare assignment. This means that the doctor has accepted to pay whatever the appropriate cost is according to Medicare. And if you plan to get an Advantage plan, make sure they participate in that plan. Before you choose a Part D drug plan, use the Medicare website to see the plan that offers the best coverage for your medication. And please feel free to schedule a one-on-one consultation if you feel you need more information by using the link that you see on this slide. Let's look at the Medicare website. This is the Medicare website, medicare.gov. And I'd like to call your attention to the fact that you can create an online Medicare account, and it would be a very good idea to do so. But let's look at how it works. In the middle of the homepage, you will see different buttons that will allow you to do a number of things. You can see what's covered. You can see plans. We're going to first start with Find Care. And to do that, you would then choose the type of care you're looking for. You'd enter your location and choose the type of provider that you want. And once you do that, it will show you some providers that are geographically close to the zip code you entered, or if you typed in their name, it would show you their name. And if you see a green check mark like this, you are safe because it means that they accept Medicare assignment, and therefore they have agreed to charge Medicare what Medicare deems to be the appropriate amount for that consultation, which means that you would have no unpleasant surprises because Medicare would pay 80% of that fee and you would have the remaining 20 to pay. However, if you see red question marks like the ones we're seeing here, be aware of the fact that while these doctors do take Medicare, they can charge 15% more than the Medicare approved amount because they have not agreed to charge what Medicare says is the appropriate cost, which means that if you see one of these doctors with a red question mark, you would be responsible for 35% because Medicare is still going to say, we're paying our 80%, but you would be responsible for more. If you have a doctor that has this red question mark, I would strongly advise you to call the number. And as you see, Medicare has very thoughtfully provided the phone numbers for doctors, and get a sense of what you would pay for that consultation. Then you can go back to the home page and look for plans. And you can look for plans either by logging in with your Medicare account if you created one. If not, you can continue without logging in, because in fact, you could start researching plans before you get your Medicare number. And once you enter the plan finder, it will ask you what kind of plan you're looking for. And it will let you choose the kind of plan. I've picked a drug plan and I've entered a zip code. And then they will ask whether you want to see your drug costs. If you do take medications, you'd say yes. And then it will ask you where you would fill your prescriptions. I would advise you to tick both mail order and retail because a lot of these plans will have cheaper costs if you use their mail order service. The next step would be to enter the name of your medication. And I have entered a medication just to give you a sense of what it looks like. You could then keep adding medications or say that you're done. If you say you're done, it will then let you choose up to 5 pharmacies. And once you have done that, you can move on to the next phase where they will show you the 28 prescription plans that are available. As you can see, Medicare has very thoughtfully sorted them by lowest drug and premium cost, which means that the first plan you see was going to be the least expensive one for you. You can compare up to 3 plans and look them over side by side. and make sure that you have the best costs, especially given the pharmacies, because some of these plans have preferred in-network pharmacies where the cost would be cheaper than with a standard pharmacy. Not to mention out-of-network would be way more expensive. And very thoughtfully, Medicare allows you to toggle over on this same page. And if you wanted to look at the 52 available Advantage plans, you would click on that option and it would take you to the Advantage plans. The Advantage plans can be filtered by using the green Filter Plans button. When you do that, it opens up this whole range of choices that will let you select your criteria. If you pick PPO, it will show you the plans that allow you to go out of network. And then you can put check marks next to anything that you would like to see covered, like vision, dental, fitness, hearing. And I usually advise that, you say that you want one with drug coverage, because there's no point in having a managed plan if then you also have to get a separate drug plan. These plans package Part A, Part B, and Part D, so you are best advised. And they have a whole range of other options, whether plans have insulin savings. You can see them by star rating. You can pick an insurance carrier that you're particularly interested in, because perhaps you know that your doctors take plans from that insurance carrier. As you can see, very user-friendly, and really helps you find the best coverage for your needs. With that, we have reached the conclusion of this seminar. If you have questions, you can click on the link that you see on this slide and sign up for a one-on-one consultation to get answers to anything that you're still not entirely clear on. We do acknowledge the fact that Medicare is quite a complex form of healthcare, and therefore, the more you know about it, the easier it will be to negotiate. With that, thank you very much for your attention, and welcome to the world of Medicare.